So welcome to part 2 of our ultrasound physics lesson. If you remember, in lesson 1, we talked a little bit about the introduction to ultrasound, differentiating between electromagnetic and sound waves, and how the properties change how we utilize this technology to visualize things in the human body. We talked about piezoelectricity, or how the application of mechanical stress onto certain substances can make them emit electricity and vice versa. And lastly, we talked about sound wave propagation. So after those waves are generated and travel into the human body, how they move through tissue before they interact with anything else. And then we stopped right at the point where we began to talk about how interacting with tissue boundaries begins to affect the way that those waves reflect, refract, or ultimately interact with the tissue itself to give us the pictures we see on the ultrasound screen. Today we're going to pick up with the second half of ultrasound physics, including a discussion about ultrasound beam attenuation, the bioeffects and safety of ultrasound, and then lastly spend a significant amount of our time talking about ultrasound artifact and applying the lessons we've learned about in the physics lessons so far to understand how this has clinical relevance for us as ultrasonographers. But first, let me start with the story. So I showed you a picture in the last lesson of my trip to Ecuador and the Galapagos Islands, and this is another picture. These pelicans were very friendly in a sarcastic kind of way. They came up and stole several things out of my pockets looking for fish, which I guess people carry fish in their pockets there. I don't really know. But anyways, the purpose is not the pelicans or the sea lion. It's these trees back here. These trees are going to serve as an analogy for our first lesson about ultrasound beam attenuation. So does anyone know what these trees are? So these are mangrove trees. Mangrove trees are a really special type of ecosystem that exists on several of the tropical and subtropical shorelines around the world. And the reason that this is a good analogy for us today is because I want you to watch this video and see how these mangrove forests might interact with wave energy. So let's start this here. So you can see as those waves come in on one side of the screen here and then pass through the mangrove forest, that wave energy is dispersed. And so there's relatively little movement of that beam on the other side of the forest. And that is a perfect analogy for ultrasound attenuation. Ultrasound attenuation refers to the gradual loss of ultrasound beam intensity as it propagates through a tissue. So let's take a look as an example at this liver. So the liver, as you can remember from anatomy, has a relatively homogeneous structure. So there's not a lot of cysts or barriers inside the liver to ultrasound beam propagation. However, as we see in this picture, down here in the far field of the screen, the image is much darker than it is in the near field closer to the ultrasound probe. And we'll talk about all the specifics and how we can verify that that's not a fluid collection or some sort of disease in a later video. But I think it's pretty easy to see from this image that the overall brightness is usually brighter closer to the ultrasound probe than it is farther away. And that's exactly what we're talking about when we refer to ultrasound attenuation. As I mentioned, the definition of attenuation is the gradual loss of beam intensity as it propagates through a tissue. So imagine we start off with these really big waves, but as it moves through a tissue, something happens where those waves' energy gets smaller and smaller and smaller, and this is reflected in the echoes that return back to the probe. So why does this happen? Well, ultrasound beams attenuate for a variety of reasons with lots of complex physics behind it. But I want us to focus on these three topics: interference, absorption, and scattering. And interference is a small portion that we're just going to briefly touch on, with the second two, absorption and scattering, being the main drivers behind ultrasound beam attenuation in medical ultrasound. Interference refers to how a wave can react to itself or to other waves in a system. So just like these three Spider-Mans kind of recognizing each other and pointing at each other and causing chaos, the same thing can happen when lots of waves or one wave is broken up and interacts with itself. Let's see how. So the double slit experiment is a classic physics experiment that I'm sure you all learned about when you took physics in high school. But as a reminder, waves, when they pass through different openings in a barrier and they refract, they can start to interact with each other. And what we see here is that there are portions of this wave traveling where the wave is getting bigger. The amplitude is increased because the wave builds on itself. And then there's another area where these waves cancel each other out and the energy is smaller. Well, the same thing can happen in the human body, although it's really not very common for a couple of reasons. First of all, remember we talked about this in the last lecture, but how the bat has to listen or else it's going to crash into a tree, and the same thing happens with our ultrasound probes. Most of the time that our probe is on a body, we're not inputting energy, we're actually listening for echoes. And so there's not a continuous standing wave where the waves have lots of opportunities to interact with each other. There just aren't that many waves going through the tissue at any given time. Secondly, when there is wave energy that can interact with other waves, the ultrasound machine technology has progressed far enough that usually there's some fancy math that can cancel that out or predict it or help interpret that for us before they generate an image. And so thanks to technology, this is not something that we really have to worry about all that commonly in the human body, but it is important to remember. Absorption and scattering are the two main ways by which ultrasound beam energy is transformed in the human body, and this results in the attenuation we've seen. Absorption refers to the way that sound energy can be converted into another form of energy, and most often this is heat energy. Every now and then a little bit of chemical energy as well. But mainly when we think about putting an ultrasound probe on a patient, we have to be aware that their theoretical risk of heating up that tissue is very real. There's also this concept of scattering, and scattering I like to think about as if I was back on that beach analogy. We have the waves coming in and they're crashing against the rocks and the sand, and normally you know the amount of energy that's held inside a wave is huge, and we can imagine that those ocean waves coming in would just push all that sand in one direction. But instead, what we know is that those waves break up. They scatter into 1,000 different directions, interacting with individual particles of the sand. And so some sand gets pushed upwards and lifted. Some sand gets pushed down into the ground and results in friction. Some sand has little waves passing between it. The same thing happens with ultrasound as it interacts with the small particles and cells inside the human body. Tiny little wavelets are pushed off in every single different direction, and that scatters the energy out until it can eventually be absorbed or otherwise lost. This is important because understanding this helps us understand how ultrasound has the potential to interact with our patient, and it explains the bioeffects that ultrasound has been documented to generate. While low risk, medical ultrasound is not completely risk-free, and so it's important that we don't sell it to patients out of a duty to ethics, that it's not a completely risk-free exam, that there are some risks associated with it, but that the risks of such exam is significantly lower than a lot of the ionizing radiation and other forms of imaging that we have available to us. Newton's first law of thermodynamics reminds us that energy cannot be created nor destroyed, only transformed. And so this principle holds true in bioeffects, meaning if we're imparting energy in the form of ultrasound waves to our patients, and we know that those waves attenuate over time, that energy has to go somewhere. And the majority of time, it comes across as mechanical energy being transformed into thermal energy or heat generation on the inside of our patients' bodies. And while most of the time this is a very minimal heat generation because of the settings of our machine, the effects of our blood redistributing heat very effectively as it flows through our bodies, and because our machines have been set up to minimize the amount of time that echoes are actually being transmitted into the body and being received. That being said, these things still do happen. And so heat has been documented to be generated. Chemical interactions such as the formation of radical oxygen species has definitely been documented. And then there's a theoretic shearing force that can occur between very linear tissues in the human body as ultrasound beams propagate between them. So this is something that we have to keep in mind. This is something that affects what settings we'll need to put the machine on for very sensitive exams. But the complex physics behind it is not something that I really expect you to understand. So a quick summary slide here. Is ultrasound safe after all? Yeah, it is. The risk is exceedingly low, but it is non-zero, and so it's important that we be honest about that with our patients when we're counseling them. Now, the risk is higher with certain modalities, and so if we're using continuous wave Doppler or power Doppler or some of the other high intensity modes, we should know that and know when it's appropriate or not appropriate to use those modalities on our patients. The best and largest studies of safety in ultrasound have shown no significantly increased risk. However, it is still important that we know that this technology is evolving and changing, and the principle of ALARA certainly applies even to ultrasound. And then the fact that this technology is evolving does mean that there's new technology, new modalities, new settings that are coming out all the time in ultrasound. And while that's exciting and it means that we're going to be able to do more and more things using point of care ultrasound technology in the future, it also means that we need to learn and be aware of the risks because they're probably also developing and growing in their own way. And so while we know ultrasound is safe, it is something that we need to continuously revisit as it grows and changes and technology continues to progress. Okay, quick trivia break. Increased exposure to ultrasound in human fetuses has been only consistently associated with one clinically significant difference in studies of those babies after they're born. Do you know what that is? So in men, it seems to show a slightly higher incidence of left-handedness. Why? I have no clue, but it's still a fun fact. So when we get an ultrasound image, how do we describe to somebody else who maybe doesn't see the screen, or when we're documenting in the chart, what we were able to identify? Let's go over the vocabulary we need to describe ultrasound images. There's lots of different ways we can describe ultrasound images, but let's go through a few. Firstly, we can describe what part of the body we're scanning. And in fact, this is probably one of the most important ways that we describe images, because during a point of care exam, you're the person holding the probe, and later on, if I'm reviewing this image, I don't necessarily know where you've put that probe on the body. And so using the language saying, hey, this is a right upper quadrant ultrasound with the probe in the transverse position, looking at the gallbladder and the liver, that would be a great introduction to whatever comes next when you're describing an image. I mentioned this a little bit ahead, but relevant anatomy to the scan that you're performing, saying, hey, I'm interested in looking for acute cholecystitis, and this is a point of care ultrasound looking at the gallbladder. Saying that explicitly is helpful so that you know that we all know we're looking at the same thing. You can describe what you see using the words echogenicity and talking about whether things are hyperechoic or isoechoic. And what these mean are hyperechoic structures, meaning very bright. They produce very strong echoes, which translate to bright images on the screen. So in this image in the center of the screen, you see a bright white object that I'm identifying as a gallstone. And that's probably one of the brightest portions of the screen, and so it's a hyperechoic. There's also an isoechoic liver above that, which means all of those sort of just grayscale organs that are in the middle of the spectrum of brightness on the screen. Those are usually isoechoic. And most often we think of abdominal organs, we think of skin and soft tissue, muscle being isoechoic structures. Relative to the isoechoic structures, you have hypoechoic structures. So those can be things like fatty liver or renal calyces or something where there's a little bit more fluid than usual, so it's a little bit darker than other areas of the body, but there's still some texture there. There's still some grit that you're picking up on the ultrasound. And then lastly, the darkest objects on the screen are anechoic. Anechoic structures are usually fluid filled, and so here the gallbladder is an anechoic structure that transmits sound waves extremely well. We also can describe the contour or the shape of objects on the screen. So you have oblong, you have round, you have smooth or irregular, and all of these help us determine that we're all looking at the same thing. And then lastly, we can talk about where on the screen we're seeing things. So we can say in the near field, there's an isoechoic sliver of the liver here. And then in the midfield, I see an anechoic structure that likely represents the gallbladder, with a hyperechoic structure representing a gallstone with shadowing that's present posterior to that. I can also see that there's some posterior acoustic enhancement in the far field thanks to the anechoic nature of the gallbladder. And so these words in combination help us determine what we're looking at and help describe the image, and overall help us determine whether or not there's some pathology that we need to be addressing. So now that we can use these words to describe what we're seeing, we're going to move on to talking about ultrasound artifact, which is one of my favorite things, and I get to combine it with one of my favorite movies as well here, only because of the word artifact. Really no other reason other than just looking at him. Look how handsome he is. So artifact represents unique cases of propagation, basically where certain things happen that cause the image that's generated by the ultrasound machine to be unintentionally off in some way. However, although this may be unintentional, this is often very helpful as a diagnostic tool, and sometimes we even rely on artifact to help interpret or define a particular exam. The examples that come to mind here are the use of artifact to help identify stones, or the use of artifact to basically do lung ultrasound, which for a while we thought we couldn't even do lung ultrasound because air doesn't transmit sound waves so easily. And once we figured out that artifact can help give us more information about what's in there, we figured out that lung ultrasound is super relevant. So let's go through examples of artifact and talk about how they're generated on a very basic level so that you can identify them when you're ultrasounding your patients. The first ultrasound artifact I want you to be familiar with is called posterior acoustic enhancement. This occurs when there's less attenuation of the ultrasound beams than we normally would expect. This occurs because sometimes structures, usually fluid-filled sacs like the bladder in this case, transmit sound waves more easily than other structures do. And because less energy is lost in the process, more energy gets transmitted and thus echoed back. Now, this is not about the speed of passage of the sound, but rather the relative amount of energy that's passed. So higher amounts of energy getting through that structure means higher amounts of energy able to be reflected and causing echoes. So the analogy that I like to use for this is, imagine that you're running a race and you have a track lined up and there's lots of different lanes, but some of those lanes have those moving platforms like you see at the airport. So you can imagine that if it was a lot easier for you to get to the other end of the airport terminal by walking on one of these, the same thing can happen with the energy in the ultrasound ray. So if it takes less energy for you to get to your terminal, you've got more energy to come back and get a pretzel before you get on your flight, those kinds of things. It permits higher throughput of wave intensity and thus causes the images to appear brighter in the far field. The next type of artifact I want to go over is reverberation artifact. Reverberation artifact takes on many different appearances depending on what's causing it. But the example in this case is a needle, and I think it's a good analogy to go through. So let's say we have this hollow needle that we're using for a procedure, and let's insonate it with some ultrasound. What happens is that some of that energy gets transmitted through the needle down to deeper structures. But because it's a highly reflective surface, sometimes you get these little reflections inside the or between the two highly reflective structures. And those reflections, then some will get transmitted and then eventually bounce back up to the machine. But what the ultrasound machine doesn't understand is it takes all things into consideration, but mainly time. So to calculate the depth of something, we measure how long it takes for the ultrasound beam to come back up to the transducer. And in this case, that little side trek of these two reflections inside the hollow needle before those echoes were able to make it back caused the machine to think that there was something at a slightly deeper depth. And this keeps happening over and over and over again. And then an image gets generated over and over and over again at regularly spaced intervals that the machine thinks is happening deeper, but really what's happening is that there's just reflection on the inside of a hollow surface. So what we can see on the image to the left is that there's this needle, and then at regularly spaced intervals underneath the needle, we're seeing linear lines that look as if there's a shadow or a reverberation of that needle. And really, there's no structure there. There's no separate needle all going in like a comb at the same time. It's just a reflection or an artifact caused by the reflection inside of those needles or structures. And this can happen with other brightly reflective structures too. For example, here is a lung ultrasound. So we know that air tends to scatter ultrasound beams, but in this case, there's a really highly reflective structure in the skin and soft tissue, and then the visceral and parietal pleura of the lung. And the same thing is happening here. We see these linear parallel lines that represent reverberations that the machine can't figure out aren't actually at that depth. It just thinks that there's a structure there. And this helps us know that, hey, if all we're getting is a reverberation artifact caused by the machine, that's the only thing it can generate down in these deeper images on a lung ultrasound, it's probably because we're not getting any strong echoes back from structures on the inside of the thorax. And so this is a normal healthy lung, and this artifact helps us define a normal healthy lung ultrasound. The next artifact is called ring down artifact. And ring down is really just a reverberation artifact, but with a particularly special way of generating itself. So let's show you how this happens. So this is the right upper quadrant. We see the liver, we see a little portion of maybe the gallbladder or kidney. It's hard to tell right there. But then the artifact is this sort of flashlight looking beam that's coming down here on the right side of the image. Now, how do we get this? Well, let's map this out. Let's pretend this pink triangle is the liver, and that this loop of bowel, which is what that bright structure is represented by the blue oval. And inside our bowel, we have all of these different little bubbles, and inside the bubbles, we have contained this little pocket of fluid. And we know that fluid really likes to transmit sound waves, and that air doesn't. There's a lot of impedance between those two structures, those two tissue types. And so when we get ultrasound beams that come down into this area, into this pocket of fluid, they get highly, highly, highly reflected inside, with only a little bit of that energy being transmitted back down to the deeper structures or up to the machines. But because there's so many reflections, the machine interprets this as a high intensity structure with lots of reflection happening, or makes it a hyperechoic structure. And this makes sense then why we see a hyperechoic line shining down, almost as if a beam from above opened from the heavens and we are looking down deeper into it. So this is what ring down artifact means, and it's just a special case of reverberation artifact. Edge artifact occurs at the edges of structures. So in this image, we also see some posterior acoustic enhancement, because look at this, the sound waves go in and it's much brighter underneath. But what I'm talking about is over here on this side, this dark or hypo or anechoic structure extending down from the edge of the gallbladder. And edge artifact occurs exactly like you would expect because of the edges of a reflective structure inside the body. So sound waves come in, they hit the edge, and at the edge they're refracted at slightly different angles, and then get echoed and return up to the machine. And so what happens is you get this wedge-shaped artifact where fewer sound waves are transmitted, and with fewer sound waves you get fewer echoes and thus a decrease in intensity. So you can move your probe around and see things that are on the in this area that currently is being obstructed by this artifact, but it all depends on the angle at which you're sending those sound waves in. Mirror artifact is a little bit more complicated to understand, but intuitively makes a lot of sense because of its name. The mirror artifact makes it look like a mirror. So what we're looking at here is the liver, and the liver is separated from the thorax by the diaphragm, which is this bright white line right between the two. And then this liver has a mass in it. This is a little hemangioma of some sort, I believe, inside the liver. And we can see that above the diaphragm on this left portion of the screen, we would expect to see nothing because there's air in there, and we know air doesn't transmit sound super well. But what we're seeing instead is almost like a reflection, a mirror image of what's happening inside the liver. And that is why we call this mirror artifact. I'm going to go to a separate slide to explain how this happens. Mirror artifact occurs because sound waves will reflect off of a variety of different places inside the body. And sometimes when those reflections are happening against something that reflects really, really well, something really shiny and linear like a diaphragm, or sometimes a bone, or sometimes a tendon, what we can see is a mirror image that's artificially generated because of the machine. Let's see how that happens. So sometimes ultrasound waves will come in and they'll hit a reflective shiny surface. Some will back up to the transducer and generate a normal image. Great. Some get bounced sideways. We never see those beams again. Others get bounced sideways and they reflect off of something. In this case, they're reflecting off of this triangle. And they go back to the diaphragm and then get bounced back up to the probe. Now, we don't know, or the machine doesn't know, that they got bounced sideways because of the angle of the diaphragm. So instead, it thinks that those are just deeper structures underneath the diaphragm. And so it generates this ghost image, or this mirror image, behind the reflective surface that's really not there, but in fact is just a representation of structures that have had this double reflection happening. Watch this cycle through one more time because it's kind of confusing. But mirror artifact is something that's really commonly encountered, so I do want you to be familiar with it. All right, the next artifact has a cute little name. It's called twinkling artifact, and it refers to the twinkling colors that occur sometimes behind a highly reflective rough surface. This is most commonly encountered with stones like kidney stones or gallstones, or in this case a urinary bladder stone. We don't fully understand why this happens, but we think it relates to noise from inside the transducer. And we can change this or eliminate this by changing the angle of incidence and the focal position of the ultrasound beams. But that being said, it actually is helpful clinically for us to find small stones inside these structures because it's more sensitive than just using shadowing, which is usually what people think about when they think of stones. So twinkling artifact is one I want you to know about just because it's kind of fun to see and it's got a cute name. The last named artifact I want you to be familiar with is called aliasing. Now, aliasing is complex, and I don't expect you to understand the physics behind it, but I do want you to know that, how to recognize aliasing. So if you're using color flow on a structure and you're expecting to see one color, red or blue, and we'll talk about how we get those later, and you're instead getting both red and blue with a mixture of other flows as well, you can think about aliasing as being the cause. And the easy answer or the easy explanation of why aliasing occurs is because there's a mismatch between the velocity of the flow being measured and the settings on the machine or the scale on the machine to measure that flow. And so basically you need to adjust your machine settings to prevent this from happening. Now, we'll talk about this more in the knobology and when you're in clinic with me looking at this, but if you see lots of rainbow colors in one spot, there's either pathology or there's aliasing, more commonly aliasing being the cause of that. So just be aware that this occurs, and we can show you how to fix it in some of your practice scanning sessions. Well, that's it. You did it, guys. We've made it through ultrasound physics. Congrats. This session, we talked about how sound interacts with tissue and how the echoes that are so important to the generation of these images are formed inside the human body. We talked about attenuation and how absorption and scattering cause the general weakening of the ultrasound beam intensity as it propagates through a tissue. We talked about how the absorption and scattering generate heat and reactive oxygen species and mechanical stress that does have some bioeffect and some safety concerns that we need to be mindful of as we utilize this technology. And lastly, we talked about artifact and gave you some examples of the different types of artifact you may encounter when performing exams. I hope that this is a helpful lesson for you, and I look forward to continuing your ultrasound journey in the next session.